Hi, my name is Phil. I'd like to talk about politics. In this video I'd like to discuss the latest data which shows that deaths in British care homes are still on the rise and how a refusal to acknowledge this is actually driving the rise. But first, if you'd like to be notified of daily news and politics, then please subscribe to the channel and click the bell notification icon. So the situation in the UK is that the official deaths caused by coronavirus are only counted in those who die in hospital. And as a result, and using the data from the Office for National Statistics, we are recording only about half of the COVID deaths in our figures. In fact, less than half really. And some will seek to support the government's decision to do so by pointing out although other countries do the same. But there are a few things I would say to that. First of all, yes, some countries do, not all. Two, some of the countries that do not count care home deaths in the figures, which they really should, but those that don't, are not necessarily turning away coronavirus patients like we do in the UK. If we at least admitted all COVID patients to hospital in the UK and then recorded their deaths, then that wouldn't be so bad. Three, the recent analysis of data of deaths across a range of European countries shows that the UK is underreporting deaths much more so than other countries, and there are a lot of other countries underreporting their COVID deaths. And four, most importantly really, to make this argument is basically playing politics by saying all other countries might be doing the same thing. That's just playing politics with a very serious situation. The fact is we need the data because it's the only way of tracking the virus. And yes, coronavirus is political in the UK. It shouldn't be, but it is. It isn't in some countries, but it is over here. And it's not because I or any other commentator choose to make it so, but because the government have made it so. But the main reason that we should be using all data is that without information on the spread of the virus, how can we possibly hope to combat it? Ministers are deliberately refusing to look at the data themselves. And the reason for this is they don't want to be able to give the figures when asked, because whenever they are asked for the figures by either a journalist or even another MP, they say they don't know. Although it was odd when last week the government said that the number of deaths in care homes was falling, and yet at the same time they were saying they don't know how many deaths are occurring in care homes. You're thinking, hang on a minute. If you don't know how many deaths there are in care homes, how can you say they're falling? But it wasn't true anyway. We now know some of the figures, they've been reported. It wasn't even a good guess that the numbers are falling. The latest figures show that the number of COVID deaths in care homes is on the increase. The second week of April, for example, had double the number of deaths in the first, and the figures are keep on rising. And MPs have been writing to the Health Secretary Matt Hancock about these figures and suggesting action. I'm not holding my breath for any hopes of this being implemented anytime soon. After all, it was only recently that elderly patients being discharged from hospital, COVID patients, were even being tested before being discharged and sent back to their care homes. So we know that statistically an awful lot of elderly vulnerable patients who may have got a bit better but were still of course infectious, because you are infectious for a good long time with this thing, were being sent back to care homes to infect a close-knit group of other vulnerable people not having been tested. And a government minister tried to argue why this was by saying that scientists had advised the government against testing patients before you send them to places where they'd be in close contact with other vulnerable groups. And if you believe that, I have a bridge to sell you. There is no way that any government scientists were advising against testing. And the numbers are going to keep rising in care homes because the government is playing a political game with the elderly in particular. So, for example, they set up the Nightingale hospitals. These were emergency critical care units designed to cope with a surge in demand that the NHS wouldn't be able to cope with. The problem was that they then didn't allow patients to use them. It was all just a political game. The London hospital, for example, it had been reported, has only treated 51 patients. Now, this is partly because there weren't enough nurses to use the actual beds available. So the government is saying, it's got this many beds, but it doesn't have enough nurses to be able to use those beds. But then the other reason is, if you looked at the list of reasons for not allowing people into those hospitals, it basically covered all the vulnerable groups that could have coronavirus. So we were refusing admittance on a whole host of grounds that basically excluded pretty much all vulnerable patients from getting the care they needed. But because so few patients were treated, the government get to say that it proves that the NHS stood up to the demand and that the government did their job in making sure that the NHS could withstand that demand. But of course it's not true. We just sent people away to die at home instead. Every patient that died of the virus at home, if they'd reported symptoms, is an example of how we didn't have the capacity, because they shouldn't have died at home. They should have been in hospital. And over 20,000 people in this country have died from the virus in their own homes, including, of course, care homes, and the bulk of them from care homes. And more responsible sections of the media, even conservative supporting parts of it, are not staying blind to this fact. After all, this is a failure of government that is hitting their core support hardest, the elderly. So anyway, I hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, then please also click the Patreon link for details. And until next time, I'll see you later.